today we're going to have Karen Varner. Karen is the director of our surgical services here at Coosa Valley. Is going to come and talk to us a little bit about our expansion of our GI suite and what we're doing that's a little bit different. And we've done all that for you to help you get in and out and to help the flow, because a GI is a very important part of what we need to be checking on every year. So Karen's going to come. Karen also helps us in our quality department. She helps us make sure that we're doing things in the right way. And you know, last month we talked about being in the top 10 of Alabama hospitals. And guys, yes, we're still talking about that, and we might be talking about that this time next year, because we're proud and we need for you to talk about that. So with that, I'm going to ask Karen to come, and then after Karen, we'll have Dr. Diamond come. And he is brand new to our community, and I wanted him to get to know you and you to get to know him. So we'll introduce him a little bit later on, but for now, Karen, I'll turn it over to you.
Good afternoon, everyone. Thank you. I appreciate the invite to come and speak to you for just a few brief minutes about what we're doing at Coosa Valley Medical Center. As Vanessa said, I am the director of surgical services at the hospital, and what surgical services encompasses is surgery and GI lab. As many of you see, we have recently expanded our GI lab. How many knows what GI stands for? All right, for those that don't, that's gastrointestinal. And what we do in the GI laboratory, or the GI lab is what we call it, some people will refer to it as endoscopy. We do diagnostic procedures on your esophagus and on your colon. We also do some procedures called bronchoscopy that looks at your lungs. And different diagnoses can be made based on the results of those tests. Treatments the physician may order will be based on the results of those tests. So most recently in August, we expanded our day surgery. Has anybody here visited our day surgery unit before? For surgery or GI or visiting a family or friend? The old one, yes, okay. We had a 9-bed day surgery unit where all outpatient surgeries and GI procedures, patients would come to get ready for their procedure. Well, as our volume has grown over the last few years, we felt that pressure of trying to get patients in and out in a timely manner. Our physicians were feeling frustrated, staff feeling frustrated, so we came together and decided that we're going to expand our beds for that area. So what we did is we pulled all those GI patients out of day surgery, and now day surgery is just an area that's only for surgical patients. The GI suite has 7 beds. There's 3 private rooms and 4 bays where you will come for your GI procedure. You'll come in, you'll come to the waiting area, someone will bring you back, put you in a room, and they'll get you ready for your procedure, and you will have your procedure and discharge home from that area. And the feedback that we have been getting so far, that it's very timely, patients are getting in and out, and very, very good results so far. So we are excited about what we have done. The physicians seem to be pleased, and we feel like that this has also helped us to flow patients through the day surgery unit a little bit better and a little more timely. So with that being said, Dr. Diamond is a new physician on our staff at Coosa Valley effective in August. He does surgical procedures. He also does work in the GI lab. So I'm going to let him come up here in just a minute and speak to you about some of the things that he does for Coosa Valley. Dr. Diamond? Does anybody have any questions for me before Dr. Diamond begins to speak?
Where's the new GI lab located?
Yes, ma'am. You still register downstairs to get your bracelet, and they'll bring you up to the waiting room. And through those double doors there from before, you'll go to the right for day surgery, and then some of our volunteers will take you just around the corner. It's right down the hallway from where we were located. We can actually see the GI lab through the door from day surgery. You just kind of go around the elevator there. But we've got some signs up if anybody gets lost, and there's always people in the hall that can help you get you to where you need to be. Any other questions for me? All right, thank you very much. Dr. Diamond, you can use that one?
Yeah. Hey, y'all. Good to meet everybody. It's been nice to get settled here in Sylacauga the last couple of months. I'm from Beulah, Alabama, if anybody's ever heard of that. It's a little 4-way stop close to Opelika. So I've been out of the state for a couple of years. It's been real nice to get back to Alabama and kind of get back to the community. So I'm happy to be here. My name is Matt. As you said, it's a little bit about me. I grew up in Beulah. I'm married, got a couple of kids, a 4-year-old and a 1-year-old. I've got various hobbies, as I'm sure everybody else does. Although I've picked up a new one today. I think I've got to learn how to make these little paper guys. That was very impressive, and hopefully I can get practicing on that. I went to school at the University of Alabama, did my medical school at UAB, and then for about 5 years I was in Jacksonville, Florida doing my residency training. That's where I've been most recently until moving to Sylacauga. Like I said, Alabama is definitely home. Florida was nice to visit, but I'm glad to be back. Just to kind of compare the two places, this is actually a pretty big town compared to where I grew up. We did have a Dollar General and a gas station, and we had one restaurant, a Pizza Day Action. So, we always knew where we were eating if we were going out to eat. So we're definitely moving up in the world by coming to Sylacauga, and it's been really nice. Just a few things about me. This is the embarrassing slide. I'll move past it pretty quickly, but various awards and honors and things like that. Moving on, y'all can look at that later if you really want to. But, why did I become a doctor? I mean, it's just to do the things that I think, you see on TV. I wanted to serve a community, especially one like this, and, really just be there for people, help them out when they need help. I have some background in engineering and things like that. I've always been a person who works with his hands. I like to build things and work on stuff, so that kind of led me into surgery. But when it comes down to it, it's all about you guys and about trying to get you through rough spots and try to help out where I can. As far as specialties are concerned, I've got a particular interest in gastrointestinal surgery. So anything from the esophagus, the stomach, the colon and intestines, down to the anus and rectum, I'm interested in taking care of. I do have an interest in laparoscopic, minimally invasive surgery and endoscopic surgery. So keyhole surgery, trying to avoid the big incisions and try to get people in and out of the hospital quickly with as little pain and as little discomfort and recovery as possible. I like doing endocrine stuff, head and neck surgery, thyroids, things of that nature. Hernia operations. I'm sure somebody in this room has or knows somebody who's got a hernia that needs fixing. I love doing that. And I really like taking care of cancer patients as well. So those are kind of some of the areas that I have a particular interest in. But I came to a place like Sylacauga specifically because I didn't want to be one of these guys who has a niche. I don't want to do just one thing over and over again. I really wanted to have a broad practice in general surgery. And so I wanted to come to a place where I don't have, a specialist in left hands that I have to compete with. I wanted to be able to take care of any problems that came through the door. So that's why I'm here. Karen's been talking about the GI lab, and I wasn't here before the new GI lab, so I can't really comment on how it was before, but I have to say that since I've been here and seen the way things are moving now, it's great. It's a great facility that they have now. Things move very smoothly, and people seem to like coming in and out. So I really enjoy working there and in the day surgery unit and in the hospital, and I like to see how I can help you guys. Anybody have questions or anything that you'd like to ask or things you'd like to hear about? Not really? Okay, sure. Well, one of the things that I do want to kind of, point out, since we're talking about GI lab today, I think it's a very important, part of our preventative health care. So people don't really like to talk about getting their colonoscopies. People kind of are worried that it's going to be uncomfortable and it's kind of an embarrassing thing. I think it's very important, and nationally we're seeing that, because if we can get people screened and catch things like colon cancer and things of that nature early, it's something that's very treatable and very curable as long as it's caught early. So if anybody in here is over 50 and you haven't had your colonoscopy yet, please come by and get signed up for one, because it's very important. It's not that uncomfortable of a procedure. You're nice and sedated. You don't remember it afterwards. You don't really experience it. You usually sleep right through it. And it's very important. We can catch some bad problems early and take care of them for you, as long as we get you in and get it done. It's so you only have to have it if everything goes smooth. You only have to have it every 10 years. So it's not something that you have to have all the time, but it's good to kind of stay on top of and make sure that you don't have anything going on that you don't want to have going on. As far as the office stuff is concerned, there's also a fair bit of stuff we can do in office for you if you don't want to have to come to the hospital and deal with checking in and taking time off work, having a ride home. There's a lot of things we can take care of you just right in the office. So if you have any kind of what I'd call lumps and bumps, if you've got abscess, or if you've got a funny bump on your skin that you want checked out, we can a lot of times check that out, and sometimes we can even take that off for you in the office. Ingrown toenails and things like that are real simple procedures that we can do in the office for you without having to worry about booking into the hospital and all that. And even some hemorrhoids and things of that nature we can take care of for you in the office. So some people in the past have had to have big surgeries on their bottoms for hemorrhoids where they cut the hemorrhoid out, and it's very painful. We can actually take care of that pretty simply in the office with just some minor procedures for you. So if you've got any problems at all and you're not sure if we can help you out, just give us a call, and we're happy to see you. We're happy to talk to you and see if we can get you feeling a little bit better. Okay? It is. It's in the Sylacauga Surgical Associates Clinic right across the street from the hospital where Dr. Campos and Murata are also. It's the first floor. So it's not the big medical professional building. It's the small building next door to that. So it's a one-story building. I'm here Monday through Friday. I'm in the operating room most all day on Monday, and I'm in the GI on Thursdays. But Tuesday, Wednesday, and Friday, I'm around for office visits. Usually Fridays, we try to get people in the mornings, but if you've got a problem and you need to be in there in the afternoon, we can accommodate that. It does, but we'll try to take care of it. If you call before everybody leaves and you need to come in later, then we'll take care of you. Mm-hmm. Yeah, I hear you. And all I can say to that is, if you let us know that you have a need, we're usually not open afternoon on Fridays unless we know you're coming. But if we know you're coming, then we can accommodate that. Yeah. In the hospital. So we're available 24/7, but the clinic's not necessarily open 24/7. So on the weekends we're available in the hospital, but on the weekends the office is closed. Any one of us can. Yeah, any one of us can take care of it. If you need endoscopy, like if you've had diverticulitis and you need a scope afterwards, either I or Dr. Campos can do that in addition to the GI guys in town. Okay. Yes. Yeah. Yes, ma'am. Yes, ma'am. Oh, that's how the microphone works. I have to hold it close to my face. I don't do biliary stents. Some of our gastroenterologists in town will do that. I think Dr. Hakeem will do that. But no, I don't do biliary stents. That is a procedure where if you have either a stricture or stones in the common bile duct that drains your liver to your intestines, you can prop that open so that everything can drain properly. Well, there's a lot of things that you could have, and if you know somebody who's having trouble swallowing, we can see them and try to get it worked up. Could be any number of things. Right.
you know, he has landed here. We were so excited to get him back to Alabama, probably second to his mom, maybe. She was excited as well. But when we go out to look for physicians, one thing that is really important to us is to find physicians that want and desire to be in our community. Because you know what? We want them here. We also look for those that have great credentials and qualifications. And Dr. Diamond came very highly recommended. It was so exciting to put those two things together, because that's what we're trying to do in our community in Wakusa Valley, is to bring the highest quality of physicians that we can to our community. People that want to be here, people that want to stay here, but people that are well qualified and come. All month, then the three of them rotate. And it's very important while we're not in the office, you know, maybe on that Saturday, but if you have an emergency surgery need, we are at the hospital. Our surgeons are on call and ready to take care of your needs. So a lot of good information came out of today, and any questions that you guys have, you know, please let us know, because we want to meet your needs. That's our whole goal and our whole purpose throughout our Wakusa Valley, is to meet you at your point of need and to bring the right physicians. I've already heard this morning, we need a dermatologist. I'm sure you have other things that you want us to work on, and we're listening to you when we're thinking of that, we're considering it. So let's all keep working together to make sure that we keep a great health system right here in our community. And it's a partner. It's a partner with our community. We're going to work hard, and we want you to trust us. We want you to use us. We want you to have faith in us. And if you have concerns and questions, we want you to call us, ask us, help us, give us your ideas, because that's what's going to make it great for all of us. So, Doctor, okay, another question. Ms. Brand?
You mentioned dermatologist, and I know her staff Dr. Diamond to say, like the rooms are small.
I sure can.
Because it's a terrible here. When we see this dermatologist every second Friday of the month, and we're lined up like, I don't know what.
Absolutely.
Yeah.
And
they look like they have little boxes with the
sure, we could do that. You know, I don't do the rashes and things like that dermatologists do, but if you've got spots, skin lumps, little skin cancers and things like that.
Which was the great information that came out of today to hear that. And that's the sort of things, I would say probably 99% of the time people are in the office. Like Dr. Diamond was saying, they'll take great care. We've got a great nursing staff in our Silicotta surgical office, and they'll see that you're taken care of.
Yeah. The colonoscopy, is that still in and out surgery, the same day surgery, or would it?
It is. In and out, and you show up in the morning, you get the procedure done, and you leave about an hour later.
Yes, in general information person at the hospital, they can tell us these things when we get in trouble.
Well, we have several people that you could call. I mean, certainly I'm always available. And a lot of you say, well, how do I reach? You can call the switchboard and ask them to find me.
Oh, we can?
Yes, ma'am. I'll answer that. I absolutely will. But now we also have administrative people on call at the hospital. We have an administrator on call, and I'm in part of that rotation. It's only Fridays. We have a rotation, but also, we have house administrators that are there on campus, and they can help you as well. So the best way to do that is call the switchboard and ask to speak with someone in administration if you have a question about what you should do. And we'll make sure you get some answers.
I'm talking about the surgery department in particular, on the weekends, even though the clinic isn't open, if somebody has a problem and they need to talk to somebody, ask a question. You don't have to come to the emergency room to talk to one of the surgeons. Whoever's on call for the weekend can be reached by phone, and we can always talk to you on the phone and kind of give you some advice. Yeah, I think I can wait until Monday. I can call you in a medication if you need it, or maybe we recommend you come to the emergency room so we can look at you. So we're always available by phone.
The call the doctor and ask that question? That has been sort of another invasive procedure for colonoscopy. You also take the same stuff.
So there's something called a flexible sigmoidoscopy, and basically it's colonoscopy-like. It's the same procedure, we just don't go all the way through the colon. So it's for colorectal cancer screening, it's not as good. If we know exactly what we're looking for and we know that it's going to be in the first part of the colon, we can do that. There are also some procedures that you can do with a CAT scanner. It's not as good as colonoscopy, but if for some reason you're under the weather and you're just not really fit to have a colonoscopy, then that is another option. The problem with that is if there's something that needs to be biopsied or anything like that, we can't do that with the CAT scanner.
Dr. Diamond also mentioned the fact that you have a colonoscopy, make sure you take your prep that is ordered by your physician as directed, because if you don't take it, they get in and can't see properly, then you're going to have it done again. So that's very, very, very important. As bad as the prep may take, and each surgeon, each physician does their own different prep, so his prep may be different than Dr. Tempo's. It's very, very important that you follow those instructions, okay?
The prep is worse than the actual procedure, to be honest.
I think that might be your amen section.
If you're over 90 and you've never had an issue, you've never had polyps, you have had polyps? I think if you're over 90, you really have to think about what is the colonoscopy going to tell me? If it finds a small cancer, am I going to have surgery for it? If the answer is yes, then it may be worth it. If the answer is no, I'm not going to have a big colon operation right now, then you're not probably going to gain a lot from a colonoscopy. So I think the guidelines, I don't do a lot of colonoscopies in the over 90 crowd, so I don't have the guidelines for that age group right on the top of my head, but I do think around 85, they really start to slack off on those guidelines that's happening every 10 years. Right. For routine screening, probably not, but if you have a problem and you're looking for an answer to that problem, then we might think about it.
Okay, Dr. Diamond, we've got a couple more questions.
Do you need a referral from a primary doctor to do your colonoscopy screenings?
So that's going to probably depend a little bit on your insurance. You need a referral for a colonoscopy?
It depends on what your insurance is. So some insurances would require that, but some would not. But if you wanted to call the office, they would be glad to tell you exactly what you would need to do. So don't feel like you've got to get out there and research that, because we have a great office staff that will be able to tell you. And then if we need to chase that for you, then we're willing to do that. So don't let that be a barrier or a hindrance to you picking up the phone and trying to get that colonoscopy scheduled.
That was my question.
All right. So, but certainly, I mean, if you want to see us afterwards, Jennifer Conley, Jennifer, you want to raise your hand? In the back is the office manager for the surgical clinic. If you want to give her your name and number and your insurance privately, we'll be glad to research that and get back to you this week. We'll be happy to do that for you.
You have one more question?
Ms. Brown's question is, if you have blood in your stool, would that be a sure sign to have a colonoscopy?
That would be a sure sign to at least come talk to us about it. That's reasonable.
Okay, any other questions? Guys, I know y'all heard him mention Lloyd banding, and I know that's something that we like to pretend that doesn't even exist. We don't like to talk about it. But it is something that's very painful and a hindrance and a barrier to the quality of our life. So that is something that Dr. Diamond did bring to the table, and he does do. So please don't ignore that, because there are answers to that and there's help for that. And certainly, it can improve the quality of your life to stop long enough to see about that. So, while we don't like to talk about it, we like to hide that and pretend that doesn't happen. We like to say it's an age thing. We got all kind of excuses for that. But you know what? It is real, and it is a health problem, but there are answers. So that's another reason to pick up that phone and call and make an appointment. And I do want to go back and say those lumps and bumps and whatever, that was a great answer today, because all of us are walking around with some things that we're a little concerned about. It's another one of those things that we look at every day and it doesn't look big and it doesn't look bad. It may look like it's changed a little bit, and it's a great thing to say, we'll just put that off. We'll just put that off. I'll see about that the first of the year. I'll check on that. I wonder if it's okay. Guys, it's another thing that doesn't need to be ignored. It's something you can have checked very quickly, be taken care of. And we all know the quicker we take care of things, the better outcomes can be for us. So a few things today to take away is, let's don't put off our colonoscomies. Let's make sure we get our lumps and bumps taken care of. If we got some of those situations going on, I think Lindsay said to me it was something about aging gracefully. I think that may be where hemorrhoids fall. I'm not sure. But that's something we can take. We can take that. I think that I haven't thought about that. I thought, that's a good point. So there's a lot of things we can take away today that all we got to do is pick up the phone and make this phone call and get an appointment. We'll be glad to see you quickly, and we'll be glad to get you in and help you get on track and help you have a clean bill of health come January. Guys, we are almost to a brand new year. And I don't know about you, but I had this list I was going to do this year, and I haven't quite done those things. So let's all get together and make sure that come our mid-January 2016 that we've got a healthier community, because we took the time to see about ourselves. So with that, guys, there's a number here that you can call. We'll be glad to give you that before you leave. We'll be glad to set you up an appointment before you leave. We'll do whatever we need to do to make it easier for you, because that's what I think it's all about here in our community. Any other questions before we close out today?
I want to thank you. We're blessed to have this hospital here, and I have to go through it.
Thank you. Yay! Well, Ms. Brown, you know what? I appreciate her bringing that point. We do not do everything at Coosa Valley. We're not going to crack open your chest or your head. But the things that we do here, we do very well. And what she said was, you're going to be taken care of, because we're taking care of friends and neighbors and families. And I recently had an experience where there was a service we didn't have, and I went and I had to do something different. And don't ever take that, we're taking care of friends and neighbors for granted, because it does make a difference. And I hope that's something we'll always be able to bring here in our community, is that we take taking care of you very seriously. And we want to make a difference, and we'll continue to do that. Thank you, Ms. Brown.
Blessing if some people go off to go to this hospital and get in a car over 65 miles.
Yes. Right, and we're signing you up for a commercial, right? Because y'all heard me say that Birmingham market, every time I go up the road, I'm thinking, oh my goodness, it's moving closer and closer. But in order for us to keep our health care in our community, again, we have to all work together to do that. So thank you, Ms. Brown, for feeling that way, expressing it, sharing it, and allowing us the opportunity to do
this long, you haven't had this hospital.
Well, you're a fabulous model for living this long, so I want to follow that. Again, let's give Dr. Dime a warm welcome. All right, we got to get Thanksgiving kicked off. I think we've got some little happies for you guys.
They wouldn't let me sign up for the door prize, by the way.
While we're getting ready to draw, let me say we are so thankful for you. And as we enter the Thanksgiving season,
You know, we have so much, and we're so blessed here in our community with not only our hospital, but our school, our churches.